professional. TexarkanaFYI.com, Hornhog Radio. And our local health authority, Dr. Matt Young, thank you for taking a few, I know you guys are just running all over the place now. Not just you, all of our medical personnel here locally. And that's what I was hoping to talk with you about is our local hospitals.
Yeah, so sure. We're local distancing, social distancing, and we're going to take our mask off, but we're going to continue to wear them.
Yes, sir.
And then after the video, but
is it just me, or have you personally noticed? There for a while, a lot of people were wearing their masks, but now less and less.
I do think there is COVID fatigue, and we feel that people are getting less and less mask usage, and also probably hand hygiene, and then maybe even not following the social distance as well. But just as you were mentioning, I think our hospital systems, our clinics, our emergency departments, we're all stressed. And so capacity is stressed, very, very tight. It's a fluid situation in the sense of weekends and Mondays are always very, very hard days to make sure that we have room and capacity.
Yes, sir.
So we're working harder and harder. However, it's community exposure. COVID is everywhere right now, and we've just got to be more vigilant now than ever before with the mask, the social distancing, and the good hand hygiene.
So, I don't want to get into exact numbers because Ms. Lisa from the Joint Operations Center will send out, they've gone back to doing daily updates now. We've kind of gotten to that level. And looking at the Bowie County fatality rate, last I looked, it was 80, somewhere around there. But I noticed at Texarkana, our Corona TXK.org, by the way, they keep up with that every day, coronatxk.org. But when I was there, I noticed that it was like 40 something patients that were non-residents to Bowie County in our hospital. So how full are we right now?
Right, so we are full, okay? And again, it's an everyday occurrence that they're trying to get the patients in the right area, be it be discharged or to a long-term care facility to make sure that we get them where they need to be. But again, we're in a critical stage in the whole COVID pandemic here in our 4 states area. And you're right, I mean, our area is a hub not only for retail, but for medical care.
Yes, sir.
And so people from Arkansas, Oklahoma, Louisiana, and then our local residents all rely on us to take care of them.
Well, that's just it. Thinking back, I once had an injury up at Cossatot Falls, and a man said to me, "Son, you can't even get a good hamburger in Deacon." So they brought me to Texarkana, And that's the thing. When you look at all of our area, everybody's coming here.
And we're fortunate to have such great health care, but we've got to remember some of the ways we can do to not tax the system is truly the mask helps. We know it helps. Good hand hygiene and social distancing help. And you mentioned the EOC and the team there with Lisa, with the city and being the public information officer. Right. Great people there. Judge Howell has been doing a great job leading us in this. Lance Hall with the Bowie County Emergency Management, Chief Eric Slaughter with Texarkana, Texas Emergency Management, and then Tracy Litton, the deputy.
The whole team, all of our local governments, Bowie County, Cass Miller, everybody is doing the best they can. I know you yourself have actually made sacrifices with like family because you have so much that you're doing. You limit your contact to close ones or folks at risk. And you were talking about COVID fatigue to all of us, but that's got to be a big effect on our medical personnel.
Absolutely. I mean, you think about medical personnel.
I'm talking about when you look at the number of fatalities, and we're talking about here locally in Texarkana, you can add up the Cass County fatalities.
Right, everyone usually comes here.
When you put all of those numbers to 80 and the 28 and these people are caring. Our nurses, our doctors, they're caring. They are committed. And then when we lose those people, it's so difficult on them. I hope folks will start taking this even more serious than they ever have.
Well, and as healthcare professionals, we are constantly exposed to it. You're seeing it over and over and over.
Right.
And so we've got to be more diligent and more careful and more vigilant than anyone. However, we just ask that if you could please do that at home, when you're at home or when you're out doing other things, follow those simple precautions to make sure that we protect each other, but we also protect our healthcare system.
Now, we got Halloween coming up. So Halloween, you know, we issued some tips on FYI about, you know, social, try to keep it outside, limit contact, wash your hands a lot, wear a mask under your costume, all of that kind of stuff. But then there's Thanksgiving and there's all these little get-togethers and those are spreading COVID.
Right. So it's going to be a different year for any of those, for Halloween, for Thanksgiving, for Christmas. We can't do what we've done in the past. And we just have to realize that getting together with family, we'll have to do it either virtual or Zoom or FaceTime. Find another avenue for it, because we don't know where our kids may have been, our aunts or uncles, our friends, and it's just too difficult to try to protect each other. And so we are recommending just get with close contacts that you're with every day and you know where they've been and who they've been with, but still also follow the precautions. I know the city of Texarkana is doing a trunk and treat.
Yep,
It's a drive-by, so no one gets exposed. It's a drive-by. They're handing out candy in
Don't
bags.
get in your vehicle. Don't.
Right. And so the kids will still get to enjoy it. Parents will still be able to get to enjoy it with their children. And we just want to make sure that everybody's safe. And then that goes as well. We understand how people want to get together and how family members have not seen each other in about 9 months, because that's how long this has been going on. But we also feel with flu season coming up, it's now more important than ever to wear those masks, to have good hand hygiene and social distancing when you can. Now, again, we're not into closing down the city, closing down the county. We want
Nobody
people,
wants that.
Right. We want people to live and try to be as normal as possible. And when you say the new norm, well, the new norm includes that, includes those precautions. And this is going to be with us for a while.
Yeah.
It's not going to be over soon.
No.
We're going to have to deal with it well into 2021, maybe even into the spring of 2021. And then we'll probably have to deal with it annually thereafter.
Yeah, absolutely. Well, Doc, I thank you for taking a little bit of time with it. By the way, I talked to some of your compadres. What do you say about the flu shots? And the one that I wanted to ask you about more than anything, because I went back and was reading some more last night about pneumonia and how many of these COVID patients, it's the pneumonia that. Do you recommend a pneumonia shot?
Well, for a certain age, absolutely. Over 65,
Over
pneumonia
65.
shot is definitely the
What
right
about if they
age.
have like some
Underlying chronic kind of health conditions, some asthma, congestive heart failure, some renal impairment, chronic renal disease? Definitely recommend talk to your provider about that. And that was a good tip on the a flu vaccine. For anybody who can take it, you need to get it. I mean, hopefully masks may help this season with the flu vaccine, seasonal flu.
That's what people, there are no flu numbers anymore. Yes, there are.
Well,
there are. It's just, we're not spotlighting them like the ones that are killing our families and friends.
And we've already seen the first flu death in the state of Arkansas.
Right.
And so what we're trying to say is it will soon be here. And there even is the possibility that the flu vaccination may give us a little protection for COVID. So, I mean, we know it protects us against influenza, the flu itself, but if it gives us a little protection with COVID, that's all the more reason to get it.
We can keep our fingers crossed.
That's right.
Thank you for taking a few minutes with us, Doc, and I'm going to let you get back to it.
Well, thank you, and I just want everyone to please realize we are at a critical level. Be vigilant in wearing those masks, washing those hands, and social distancing.
And just to, one more time, because this is important, our hospitals are full.
They're at a stressed level. They can handle mostly what we see on a day-to-day basis, but again, that changes. And so many times we see that and we know that and we try to help work with it.
We need to be extra vigilant.
That's right.